Hello, my name's Maria. I'm a member of the Women's Network at the RCOG, and I'm also the CEO of a perinatal mental health peer support group called Mothers for Mothers based in Bristol. And I wanted to come along and talk to you because it is Maternal Mental Health Week. I wanted to talk to you a little bit about maternal mental health. Maternal mental health is a whole spectrum of illnesses, and at the organisation I work for, Mothers for Mothers, we support women all the way across that spectrum. So women who may be feeling a little bit lonely and a little bit isolated, women who may be feeling a bit more anxious, and they may be anxious during their pregnancy or after their baby's born. They may be feeling a bit low in mood. That may go on and they may become severely anxious, or they may become very depressed. And there may be other illnesses going alongside this. They may have suffered a birth trauma and feel anxiety and depression relating to that. They may be suffering from maternal OCD or a post-traumatic stress disorder. They may be struggling to adjust to parenthood, and they may become very seriously ill and need help from specialist services or a stay in the mother and baby unit. And we support women all across that spectrum, whatever's happening to them, from when they're pregnant until their child goes to school. We're there to offer their social support, and when somebody is significantly ill, we offer that support alongside colleagues in clinical services. So I just wanted to talk to you a little bit about the various maternal mental illnesses and how we can support mums. The theme for Maternal Mental Health Week this year is supporting mums through difficult times. And of course, we're having a very difficult time at the moment with a global pandemic. So it's very fitting to be thinking about how we support families through these difficult times. There's lots of support available at the moment for women, but unfortunately lots of women aren't coming through to various services and are worried about putting pressure on the NHS. But it's really, really important that if women do need help, that they do feel able to seek this out. They can still talk to their midwife, their consultant, their GP, their health visitor. The services remain open and people can reach out to them and talk to people about their well-being, and if necessary get onward referrals to specialist services which are still open, and if necessary mother and baby units. And there's lots of voluntary sector organisations like my own, charities, who are still offering a service and still able to work with women who may be becoming anxious or worried because of the pandemic. Or it could be that they have a pre-existing mental illness which has got worse in their pregnancy or worse since they've given birth to their child. And it's really important for us to remember that lots of women who are pregnant at the moment are having very different antenatal care and very different birth choices to what they had probably been expecting at the start of their pregnancy. And women who've given birth to babies during this time will be having a very different postnatal experience and maybe struggling with the fact that they're unable to share their new baby and share this part of their lives with close family and friends. So we need to be, really aware that these women may need support, and we need for them to hear the message that services are open and they are able to contact people if they need to. At Mothers for Mothers, we've had to change all of our services, and many third sector organisations have changed their support services in response to COVID-19. So we have stopped doing face-to-face work, but all the work we do is now available virtually. So we have a helpline that's open every day from 10 in the morning till 9 at night. We make support calls out to women as well. Women who are more poorly get video conferencing with us, and that can be as often as every day if they need it. And we have a Zoom group as well. One of our support groups takes place via Zoom, where women come together to talk together, and we have peer support workers working alongside them in that group. We have a closed Facebook group where we've got lots of different activities going on, and we've got lots of activities planned for Maternal Mental Health Week, and we've got things in there for the children as well. So that's really all I wanted to say. I just wanted to talk about Maternal Mental Health Week, to talk about maternal mental health, to urge everyone to look out for any chance to get the message across to pregnant women and women with young babies that services are still available for them, and if to ask everyone to get behind that message of supporting mums during difficult times. It's difficult for the professionals and for the services to reach people, so the more we can talk about it and the more people can hear that services are open and that they can ask for support, and there's no shame or judgment in asking for support at this time. Everyone is troubled by anxiety and isolation due to the restrictions upon us in the pandemic. But if you're a new parent and you're at home on your own with a new baby, we need to be even more mindful of that at this time. So anyone who's able to share things over Maternal Mental Health Week, we really, really appreciate that. Thank you very much. Bye bye.